Thursday California briefing. I'm Selena Oster, your moderator for today. Today's topic is about changes to Medi-Cal, California's version of Medicaid. Federal and state policy changes are bringing changes to Medi-Cal, which serves over 14 million Californians, or one-third of the state. In this briefing, leaders and policy experts from the California Department of Healthcare Services will discuss state budget impacts and federal requirements and new CalAIM services that will change Medi-Cal in 2026 through 2028. Our speakers from DHCS will clarify who's impacted, when changes will go into effect, and answer questions about which health services remain unchanged. And I now welcome our expert panel, including Tyler Sadwith, who's the State Medicaid Director at DHCS, and Yingjia Huang, who's Deputy Director for Healthcare Benefits and Eligibility at DHCS. We ask speakers to speak at a moderate pace for our simultaneous interpreters in Korean, Mandarin, and Spanish, and let me know if I'm speaking too fast. We ask reporters to enter questions in the chat, letting us know your name and your outlet. As we anticipate many questions, and we're already getting them, rather than a question and answer period after each speaker, they will each present for about 20 minutes, and then we'll open it up for a longer question and answer period at the end. But our speakers are also free to answer questions in the chat whenever they want. And so we begin with Tyler Sadwith, State Medicaid Director with DHCS, who will talk about the broad federal landscape of changes to Medicaid or Medi-Cal in California. Go ahead, Tyler.
Thank you, and good morning, everyone. My name is Tyler Sadwith, and I serve as the State Medicaid Director here in California. I want to thank you for joining the California Department of Healthcare Services for this first ethnic media briefing of this series. I want to start by recognizing that you are the trusted voices in your communities, and that many immigrant families, undocumented Californians, and other Medi-Cal members rely on you to deliver accurate information about the many changes that are happening to Medi-Cal. Before we get into the details of today's briefing, I want to highlight that the Department of Healthcare Services is committed to sharing the most up-to-date information and changes to Medi-Cal, regardless of where those changes come from. What matters most is how these changes affect members and what they need to do to stay covered under Medi-Cal. In addition to these upcoming changes, we're continuing our long-term work to transform Medi-Cal through the CalAIM initiative, making Medi-Cal more equitable, coordinated, and focused on whole person care. As it comes to recently announced changes due to federal constraints, we know and we acknowledge that they can create confusion and sometimes fear. Some of these policies can carry real consequences for the lives of Medi-Cal members. We are committed to sharing information so that Californians can make informed decisions for themselves and for their families. I want to take a moment to share a little bit about how today's talk will work. I'll walk through some of the major changes coming to Medi-Cal, including new federal rules that take effect in the coming years. Then, my colleague Yingjia Huang will go into more detail about additional changes and what members can do to keep their Medi-Cal coverage. To summarize, our goal today is to give you a full overview of the relevant federal changes required under the new federal law, the state budget changes for Medi-Cal, and what families can do to stay covered and keep their Medi-Cal benefits. And after our presentations, we're more than happy to take your questions. So to start, I want to give a brief overview of Medicaid, known as Medi-Cal, here in California. Medi-Cal is the largest Medicaid program in the nation. Nearly 14 million Californians rely on it for healthcare coverage. The Medi-Cal program is truly a lifeline for children, older adults, people with disabilities, pregnant women, and millions of low-income Californians. Medi-Cal benefits include services like visits with your doctor, hospital stays, emergency department care, mental health services, prescriptions, transportation to appointments, and so much more. In addition to these core benefits, Medi-Cal also includes newer services and newer supports that help address people's broader health-related needs, things like housing supports and activities and supports with daily living. My colleague Yingzhe will talk more about some upcoming changes to benefits, including how we're continuing to improve Medi-Cal to better serve members and reduce health disparities through CalAid. Even with upcoming changes, it's important to emphasize that Medi-Cal will continue to support millions of Californians, and we are committed to the health and well-being of all individuals with healthcare coverage under Medi-Cal. I want to take one moment to address the ongoing reports and conversations about the Department of Homeland Security and ICE officers using Medicaid data. As of August 12th, 2025, a federal judge blocked the United States Department of Homeland Security from using any Medicaid data for immigration enforcement purposes. In August, the federal judge also prevented the United States Health and Human Services Agency from sharing Medicaid data with the Department of Homeland Security. California joined and led a multi-state lawsuit that secured this important protection. The United States Department of Justice has confirmed that the Department of Homeland Security is currently not using Medi-Cal data obtained from California for immigration enforcement purposes. Just by way of background, by law, California submits Medi-Cal data every month to the Federal Centers for Medicare and Medicaid Services, the federal agency that oversees Medicaid. California has never shared new or additional data beyond what federal law requires. The monthly data that we share as part of the routine Medicaid program includes basic demographic and eligibility information, things like name, address, date of birth, Medi-Cal identification number, social security number if provided, and broad immigration status. CMS is legally required to keep this data confidential and secure, and this data is used for the administration of the Medicaid program. Any misuse of Medicaid data, including Medi-Cal data, is unlawful and a serious breach of trust for the state and especially for immigrant families. We do want to note that canceling Medi-Cal coverage or disenrolling from Medi-Cal does not take back or erase any information that was already sent to the federal agency that oversees Medicaid, CMS. For individuals who want more information or who are concerned about how the federal government may use their personal information, we will provide some resources in the chat for further information. We know that concerns about data sharing and immigration enforcement can create fear, especially in mixed status households. That's why we want to take a moment to reassure families about who remains protected under Medi-Cal and who remains covered under Medi-Cal, including with upcoming changes as a result of the state budget process. To clarify, children and pregnant people, regardless of their immigration status, remain eligible for full scope Medi-Cal. This includes medical care, full dental coverage, mental health care, prescription drugs, and other essential services. Children under 18 will continue to have full scope Medi-Cal, including dental care, no matter their immigration status. Pregnant people will also continue to have full scope Medi-Cal, including dental care, throughout their pregnancy and for 1 year after their baby is born or their pregnancy ends. Income limits for children and for pregnant people are different than they are for other populations, such as adults. This is not a new change, and no changes are being made to income rules. However, we wanted to highlight this because sometimes families and parents are not aware that they are eligible or that their children may be eligible to qualify for Medi-Cal. These protections and these benefits coverage remain in place, and we want families to feel confident about using their benefits and staying connected to care. Now, I want to take a moment and talk about the recent federal law that was passed. This is sometimes called H.R. 1, or also known as its title, the One Big Beautiful Bill. This federal law imposes new rules for state Medicaid programs like Medi-Cal, many of which begin in 2027. I want to lift up a few key changes from this new federal law that may impact Medi-Cal members. The first big change is about work requirements. Beginning on January 1st, 2027, some adults between the ages of 19 and 64 will be required to work, to volunteer, to be in school, or to participate in job training for at least 80 hours every month to keep their Medi-Cal coverage. And the participation in work or in volunteering or community engagement has to be documented in a way that the Department of Healthcare Services can confirm it to keep eligibility. To meet work requirements, members must do at least one of the following. They can work 80 hours a month in a job. They can get paid at least $580 per month. They can be a seasonal worker who made an average of $580 per month over the last 6 months. They can be in a training program, or they can volunteer. They can be in school at least half-time, which means taking a few classes each semester. Or they can do a mix of volunteering, school, work, or job training for a total of at least 80 hours per month. It's important to note that there are many exemptions to this requirement, which again applies to adults aged 19 to 64. Even among this population, there are some exemptions, and for other populations, just to clarify, children aged 0 to 18 are not subject to these new requirements. Adults aged 65 and older are not subject to these requirements. Pregnant people, including new parents and mothers for 1 year after the baby is born or the pregnancy ends, are not subject to these requirements. Additional exemptions include parents with children under the age of 14, people with disabilities, people with serious health or mental health conditions, including substance use disorder, people released from jail or prison within the last 90 days, American Indians and Alaska Natives, and foster youth under the age of 26. All of these individuals are exempt from meeting work requirements. If a Medi-Cal member is required to work or volunteer under these new federal rules and they do not meet the rules, they could lose their Medi-Cal coverage. The Department of Healthcare Services will take every possible step to ensure that we obtain the data that we are able to obtain to determine if individuals are exempt from these rules or if they meet these rules. Medi-Cal will send out more information before these rules start and provide resources to help members with understanding and meeting these requirements. There's another new change coming as a result of the federal law that I want to highlight. This is about how often your Medi-Cal coverage has to be renewed or redetermined. Beginning January 1st, 2027, Medi-Cal members between the ages of 19 and 64 who do not have dependent children younger than age 19 will need to complete their eligibility renewal twice a year instead of once a year. If this applies to you, Medi-Cal will send you a letter. We acknowledge that this increases paperwork and it increases the risk of members losing coverage for administrative and paperwork reasons, even if someone still qualifies. The department seeks to minimize the impact of these new requirements by automating the process as much as possible. For example, if the Department of Healthcare Services can determine a person's eligibility by using available data systems that we have, we will not have to ask any members for additional paperwork. That's our goal. There's one more key change coming as a result of the federal law that I want to highlight. This is about co-payments. Beginning in October 2028, some adults may need to pay a small fee for certain services, like specialty care or certain tests. Core services like emergency care, regular primary care checkups, prenatal care, pediatric care, mental health services, and substance use treatment remain free, and there is no copayment. There are some limits regarding how much members will need to pay for these other services. The department will work to minimize the impact to members as much as possible within the available options under federal law. These are major shifts. They are coming from the federal law that Congress passed and the president signed, and California is working to implement them in a way that protects members and minimizes the impact on members to the maximum extent that we can. We want to be transparent about the significant impact that this law will have on California and the overall healthcare system. These new work requirements will be hard for some adults to meet, especially individuals who have unstable work, seasonal work, or who are caregivers for loved ones. 6-month renewals instead of annual renewals doubles the paperwork, and it increases the chance that people lose coverage simply due to missing forms, not updating information, or not receiving the paperwork in the mail. Co-payments, even if small, can be a real barrier to low-income Californians who are already struggling. We know these are real challenges. The department is committed to doing everything we can to minimize disruptions and keep people covered and connected to care. We will be providing members with advance notices 90 days before upcoming changes, and will be working in partnership with trusted members of the community to spread information, make people aware of changes, and offer resources and tools to help people stay connected to care and keep their Medi-Cal. The department is committed to keeping members informed, to protecting families, and to help making sure that people know their options. I want to thank you for your time. And at this point, I want to turn it over to my colleague, the Deputy Director for Healthcare Benefits and Eligibility at the department, Yingzhe Huang, who will dive deeper into the state budget changes and what they mean for Medi-Cal members next year, and what Medi-Cal members can do to stay covered. Thank you again for your partnership and for helping us to keep Californians informed. Yingzhe?
Thank you, Tyler, and good morning, everyone. I'm Yingzhe Huang. Nice seeing many of our media partners here again, and really thanking you for your time this morning to be here with us to learn a little bit about the upcoming federal and state changes for the Medi-Cal program. I want to walk you through some important Medi-Cal changes that are part of this year's state level changes. Tyler walked through a lot of the federal changes that we are preparing for in the upcoming years. And I will walk you through some of the state level changes in California as a result of the California state budgetary changes. First, wanting to acknowledge that these changes may raise questions or concerns, especially in immigrant communities. And already I'm seeing many questions from our ethnic media partners in the chat, and we'll do our best to answer them shortly after my presentation. And our goal today here is to make sure you have the facts to help families stay informed and covered. When they hear about budget cuts or policy changes, I know there's lots of worries that they will immediately lose their Medi-Cal benefits and vital access to necessary and critical services. This is not the message that we want to convey. We want Medi-Cal members to know that we still highly encourage them to take advantage of their healthcare benefits, including preventative care, like seeing a doctor. Really, the message here is please go and use your benefits. I do want to emphasize that most Medi-Cal members are not impacted by the state level changes, but for the smaller group that is impacted, I will kind of walk you through what's happening when and what steps families can take to maintain their coverage. We know you're all very trusted messengers in our communities. We worked with you during the last few years to spread the messaging on redeterminations when Medi-Cal renewals were restarting again. We saw the benefit of that, today, and we're very thankful of the messaging that you have helped carry throughout the community. Today, we're asking for your assistance again, and our goal is to give you the facts so you can help the communities stay informed and prepare to make these very important decisions for their family. First, wanting to start off with what is staying the same. To start, like I shared earlier, most Medi-Cal members, nothing will change. Medi-Cal continues to cover a breadth of services, doctor's visits, hospital stays, medications, mental health, substance use order treatments, preventative services, long-term care and transportation, dental and vision, and also health-related needs outside of a traditional doctor's office setting. And we sometimes hear it referred to as community supports, which is part of the CalAIM suite of benefits. And we will be discussing this in further briefings, but excited to announce that we have added a community support called transitional rent into kind of the CalAIM umbrella, which is a 6-month of rental assistance for Medi-Cal members experiencing or at risk of experiencing homelessness. This new benefit became available in April of 2025, and Medi-Cal health plans are required to provide it to eligible Medi-Cal members beginning in January of 2026. So more to come on that in a separate briefing. But really refocusing on some of the state level changes around what's going to be changing when January 2026 happens. We know families sometimes hear rumors that Medi-Cal is going away or that they will lose their benefits. That's not true. If you're already enrolled in Medi-Cal and continue to qualify during your renewal periods, you will continue to be a Medi-Cal member and have access to Medi-Cal benefits. And when I say renewal period, that is that yellow packet in the mail that you do receive on an ongoing basis. It's an annual process. And there will be some changes, as Tyler mentioned a little earlier, for a specific group of individuals. However, that is in January of 2027. But putting that aside, that those individuals will still go through a routine renewal redetermination, and just as long all those the information is provided back to complete the renewal process, you will continue to have access to the full scope of Medi-Cal benefits. So zooming in a little bit and talking about who is impacted by the state level changes. Some changes apply to undocumented adults who do not have an immigration status that qualifies them for federal Medicaid and who are not pregnant. We'll drop a link in the chat to a chart that outlines the immigration statuses that are impacted by these state level changes. And the immigration statuses should look familiar in the sense where these are the statuses that is on the Medi-Cal application today. So any person applying on benefitscal.com or coverca.com, as they are entering their information, there is a drop-down box for them to select the applicable immigration status. So the statuses on the chart should look very familiar. And just noting that the information described in this chart does not yet reflect the federal changes from the House Resolution 1 or the One Big Beautiful Bill that Tyler discussed earlier. So we will be working on a separate document to share more in terms of how that will modify based upon the federal changes, and that will be shared at a later date. Additionally, some adults will be impacted because Medi-Cal will once again look at what you own, which we know in the community as assets, and not just how much you'll make when reviewing eligibility for older adults and people with disabilities. So as we are kind of talking through the 4 key changes at the state level, I'm just going to walk through them by bucket. So the first bucket, or the first change, is the enrollment pause. Starting January 1st of 2026, there will be a pause on new full scope Medi-Cal enrollments for undocumented adults that are 19 years of age and older who do not have an immigration status that qualifies them for federal Medicaid. And this is where the chart that is being dropped in the chat will be critical. There are columns within the chart that outlines the different policies and which immigration statuses it impacts. And wanting to really point out here that even with the enrollment pause in place, pregnant individuals and children that are 18 and younger are not impacted by this change. This is regardless of immigration status. They are not impacted by the enrollment pause. For individuals that are already enrolled in Medi-Cal, and you have and you're undocumented and you're in one of those immigration status, but you're already enrolled prior to January 1st of 2026, you will remain enrolled within with that full breadth of services, just as long as you keep renewing your coverage. So this is where it's very important that if you are already a Medi-Cal member enrolled in coverage, make sure you are completing your renewal process, returning the necessary paperwork to the counties so that you remain enrolled. So we're calling this group the grandfathered in group, just because you will not be impacted by the actions, the changes beginning January 1st of 2026. The enrollment pause is only applicable to the undocumented individuals, adults 19 and older, who are newly applying. So on January 1st, for example, if I am in one of those immigration statuses in the table and I meet the income criteria for Medi-Cal, however, my immigration status falls in that column, I will only be eligible for what we call restricted scope Medi-Cal. And sometimes in the community, you hear it as emergency Medi-Cal, which is a concept we had prior to many of the state level expansions. Emergency Medi-Cal covers emergency care and pregnancy related care, which also includes delivery, at labor and delivery. So that's very important for folks to know. And even with emergency Medi-Cal, if you're pregnant, your coverage you will actually have you'll be able to access the full suite of benefits throughout your pregnancy and through your 365 days, through 1 year postpartum, after the baby is born, or when the pregnancy ends. So it'll be 1 year after when the pregnancy ends. So talking, the next piece is the second change that's coming up is the dental coverage change. So starting July 1st of 2026, undocumented adults or adults who does not have the immigration status that qualifies them for federal Medicaid and are not pregnant will not have access to Medi-Cal dental. And this is the routine dental benefit that's part of the Medi-Cal package today. So simply put, beginning July 1st of 2026, there will be the dental benefit will be eliminated for adults, undocumented adults 19 and above. And again, children and pregnant individuals are not impacted by this change. Again, pregnant individuals will have full access to the dental benefit through the end of their 1 year postpartum period. However, you will still have access to emergency dental, such as treatment for intense pain, infection, or extractions. Those services are considered by the doctor's determination. They will be covered under Medi-Cal. It is just the regular routine dental visits. Those pieces will be eliminated as part of the dental coverage changes beginning July 1st of 2026 for undocumented adults 19 and above, with the exception of children and pregnant individuals. The third change I'm going to walk you through is there will be some upcoming changes in terms of fees or monthly premiums. So you'll hear those two terms being used that certain adults will need to start paying beginning July 1st of 2027. So starting July 1st of 2027, undocumented adults 19 through 59 with certain immigration statuses, again, that do not qualify under federal Medicaid and will be required to pay a premium of $30 a month. And in the chart, you will see a column very specific to which immigration statuses are impacted beginning July 1st of 2027. Again, here for this change, pregnant individuals, children under the age of 19, and individuals that are 60 years and older are not impacted by the monthly fee/premium. Those individuals will not have to pay the monthly premium to maintain their access for the full breadth of Medi-Cal services minus dental. So the $30 each month will ensure continued access to benefits such as doctor's visits, prescriptions, hospital care, mental health treatment, and vision. Members are required to pay the premium or risk losing their current coverage. And the department is committed to making sure that all these changes ahead of the implementation of all these changes, impacted members will receive multiple notices to inform them of the upcoming changes. And specifically for the monthly premium, we will be sending multiple notices ahead of time. And there will be a monthly invoice sent to the member as well on an ongoing basis to also let them know the payment is due, where to remit the payment, etc. So there will be multiple notices that will be sent to make sure that notification is met. So if a member misses one payment, nothing happens right away. We do allow what we call a 90-day grace period, basically 3 months. So we allow individuals to stay on coverage for 3 months, even though they missed a payment. If they do not make the payment after 90 days, we will be moving or changing their scope of benefits from their current scope to emergency Medi-Cal. Again, re-emphasizing that children under the age of 19, older adults 60 and older, and pregnant individuals do not have to pay this small fee. I would always look at I would look at the immigration chart that's being dropped in the link to make sure you have a sense of what immigration statuses are impacted. Lastly, the last change here that I do want to talk about is the asset test. Sometimes you hear it in the community as uh, what you own. This is another important change. The asset test is returning to the Medi-Cal program at application, at renewal, beginning January 1st of 2026. Medi-Cal will again begin looking at assets when we review your eligibility. And usually that group is for individuals that are 65 and older and people with disabilities. And this is part of the federal rules as it relates to the Medicaid program for that group. This does not apply to most children, parents, pregnant individuals, or single adults where eligibility is largely based on income. And so you may hear about property and asset tests, and it's very specific to certain groups of individuals due to how Medi-Cal eligibility is calculated and determined. The asset test, the return of the asset test is $130,000 for one person. So that is still dramatically higher than the old asset test, where an individual can only have up to $2,000 per person. So when January 1st happens, that asset limit is $130,000 for one person. And your assets include, when we look at what that means, is the amount of money you have in your bank accounts, your cash savings, and anything above one home and one vehicle. That will count towards that $130,000 as part of the asset review. And each additional household member adds $65,000 to a maximum of 10 members per household. It's important to remember the home that you live in, the one car, one vehicle that you own, certain household goods, retirement accounts do not impact your Medi-Cal eligibility. They are not part of the asset test. So if you're already a Medi-Cal member, assets will be reviewed at your annual renewal, which begins next year. The income limits do not change. So next steps for immigrant communities, we really want to emphasize that for families, the most practical message is to keep your contact information updated and renew your coverage on time. I cannot emphasize that enough. The renewal will be extremely important so that we are making sure that you're retaining and continuing your current level of benefits with all these various changes that are going on. Keep your mailing address, email, and phone number up to date with the county or on benefitscal.com. You could access your case online by clicking into the link. Watch for the yellow renewal packets in the mail or the text messages from your county. The county will text you when it's time for your renewal. They usually text you twice to remind you. So if you do miss a deadline, remember that you have 3 months to send in your missing paperwork and keep your coverage. If you don't do that, you will have to reapply for the Medi-Cal program. We encourage families to use your benefits. Go see a doctor, fill prescriptions, and get the preventive care you need. If families are unsure if they are impacted or not, DHCS has created a website that we will drop in the link for you to take a look just to check whether this information helps you or not, or otherwise you can also call your local Medi-Cal office as well. In closing, our ethnic media partners are a lifeline of information for our communities. I know just from experience, our Medi-Cal members trust you, and your reporting can prevent fear and confusion. Please help us get out the messages that Tyler and I shared with you. Medi-Cal is still here. Families just keep using their benefits and making sure they renew their coverage. When you get that yellow envelope, when you get those text messages from your county, please respond. And with that in mind, we thank you for your time and we're here to answer your questions.
Thank you so much, Yingji and Tyler. I want to say when I checked the RSVPs this morning, there were 50 some, and I'm now seeing 90 some people here. So people very much want this information, and you both couldn't have done a better job of breaking it down clearly. So I've been going through the questions to mitigate the repeats and points already answered, but if yours hasn't been, feel free to ask it again as we continue taking questions from reporters. Araceli Martinez and Juan Carlos Diaz ask similar questions. What are the options or alternative programs for undocumented adults who won't be able to enroll in Medi-Cal or other low-income members who can no longer stay?
Um, and I can take that. So that's a great question. As this is evolving, I know in the past when we did not have the eligibility expansions for this group, there were a lot of what we call county indigent programs for this population. So I think right now I don't have an answer for that. But what we are looking to do, as you know, the budget policy changes are in development, we will be in close conversations with our counties, and we'll make sure to share any information that is available once we complete conversations.
Got it. And Fatma Baki asks, what steps should Medi-Cal recipients take now to prepare for the changes?
I think firstly, take a look at the chart and the website that DHCS has linked in the chat. Secondly, make sure your contact information is updated on BenefitsCal or coversca.com, depending on how they apply for coverage. That's the most critical. Making sure their information is the most up to date will help us as we are rolling out these changes. And if there's still hesitation, please call your county.
Got it. Thank you. And Nestor Fantini asks, of the 14 million Californians enrolled in Medi-Cal, how many do you expect will be disenrolled?
We shared information recently in a webinar, and we can probably actually link that webinar and the presentation that the Secretary of our Health and Human Services Agency led in partnership with the Director of Healthcare Services in the chat. We estimated at the time that as a result of the federal law, and specifically looking at the work requirements and the 6-month renewal requirements that I talked about, up to 3.4 million Medi-Cal members would be at risk of losing coverage. And so we are working right now to set up the processes and the systems in place to try to reduce that number, because that's really unacceptable to us. But at the time, we estimated that up to 3.4 million Medi-Cal members would be at risk of losing coverage.
Okay, thank you. And Irene Bazan and Sandy Close also ask similar questions. Undocumented people who missed the Medi-Cal enrollment deadline, will they still be able to access emergency Medi-Cal? I know they can. And how will they apply for it?
That's a great question. If you will still be eligible for emergency Medi-Cal if you meet the income requirements. The application is the same as the current Medi-Cal application.
Okay. And as for those who are already enrolled, this is from Sandy, will they continue to get Medi-Cal and will they need to pay 30 per month after 2027?
Yes, only for the individuals with a certain immigration status. So beginning July 1st of 2027, they will have to pay the monthly premiums.
Okay. Elena Kuznetsova asks, in regard of Medicaid, Medi-Cal, is there a risk that it may become a subject of public charge, meaning that fewer immigrants will be able to afford it or may even be denied?
At this time, from a federal perspective, there's no updates on the public charge final rule. I think what we do have from the federal government is what was during the Biden-Harris administration, and that is still in effect today. So there's no changes that we know at this time, but again, that's correct as of today.
Okay, wonderful. And Sunita Sarabji asks, what is the rationale for imposing premiums?
And I think for us, just as we've shared through the legislative session, I think really looking at the California state kind of budget on an ongoing basis. And that is, we have to look at various options. And this is the one that, this is one of the many that we will be implementing as a result of that.
I do know that they were drastically reduced in the revision to 30 from three times that, if not more. So, um, um, Fatma Bakit, how is California planning to protect low-income families from losing coverage due to new federal requirements? I guess I'd pair that with another question. Is there anything else that can be done to mitigate or counter the effects at the individual local level? That's from Satya Wedner.
Yeah, and I think re-emphasizing what Tyler has shared as the policies for this is evolving and we're thinking about operations. We will be utilizing all the information that's available to us in terms of exempting individuals from the work requirements like component of the One Big Beautiful Bill, for example, which we know will be the most impactful with the federal changes. So right now, I think we'll just want to keep reassuring the community that we will make every effort to do that. And we'll continue working on this and, sharing this with the group as this evolves.
Great. And as from Pamela Anchang, as Medi-Cal prepares for these changes, are there plans to partner with trusted community media, ethnic outlets, and grassroots organizations to reach immigrant families where they are?
Yes. So I think maybe just simply the answer is yes. And in what way we're still kind of in development and in discussion, but we know through the unwinding work with many of you, this is a very critical outlet of information. And so we value that tremendously. So more to come on it, but definitely something we are discussing internally.
And there's a question from Sandy, how different or unique or not is California from other states and its approach to Medicaid cuts?
So this is Tyler. I would say that right now, a lot of states are experiencing what California is experiencing, which is a twofold pressure. One is the state budget condition, and the other is the federal cuts and funding and eligibility as a result of the federal law. And so as a result, we have seen, even in budgets recently released by other states, similar types of policies around sort of eligibility freezes. We've seen states respond to these pressures with reductions or cuts in provider rates. And I think we suspect that this is just the first step that states will take to address, again, sort of the compounded pressures of down budget years coupled with federal cuts in funding. And so, unfortunately, many states throughout the country will be looking at how to try to sustain their Medicaid program as best they can, while also balancing the budget and relying on less federal funding than ever before. And unfortunately, what that means is states often look at reducing benefits, reducing eligibility, and reducing payment rates.
Okay. And I know there have been efforts among blue states to band together, particularly with the West Coast Health Alliance, which I know has more to do with reporting. But I'm wondering if California risks getting punished by the federal government for even protecting as it does its efforts to provide health care to undocumented people already enrolled.
So we're committed to providing healthcare and meeting the needs of our residents. We do operate the expansions that have rolled out over the past few years for Californians with unsatisfactory immigration status, including individuals who are undocumented. And we operate these programs as a state-only program. We are absolutely committed to ensuring that we operate these state-only programs within applicable federal laws and federal rules, and that we only draw down federal funding as appropriate and consistent with federal policy. So we're absolutely committed to maintaining these important state programs.
Cool. Very, very good to hear. And there's an interesting question from Maria Oliveira. Will people who have Social Security but are not regularized, like TPS, also be considered undocumented?
If they are under the federal Social Security programs, that's not a state operated program. So those individuals are not part of any, will not be impacted as part of any of the state budget changes. Yeah, if I'm understanding the question.
Yeah. Okay. And from Henrietta Burrows, is there an appeal process for those who have been removed or face removal from the rolls?
The state fair hearing processes continues to apply for all Medi-Cal members, regardless of immigration status. So, for whatever reason, if the individual is removed or disenrolled from coverage, the state fair hearing rights will still be on the notice, and that will be available to everybody.
Okay.
And
And
And I just want to follow up and provide an additional reference to the question around the temporary protected status individuals. The chart that Griselda popped into the chat, there's a link to a chart that breaks down various immigration categories. That's a really helpful reference to understand within these various immigration statuses who was considered unsatisfactory immigration status from a federal perspective, and what does that mean for all of the different state budget policy changes that Inja described, such as the expansion fees with dental benefits and monthly premiums. So that's a really helpful one-stop shop to understand those specific questions.
very, very good. Thank you. And from Manuel La Cruz, are these measures permanent or will they change over the months and with the decisions made by the government? I know there's been a lot of back and forth on the data privacy part, particularly.
So what I would say are that the changes that I described that are a result of the One Big Beautiful Bill Act are here to stay unless Congress acts and passes law to change them. So things like the work requirements, the 6 month renewals, the co-payments, those won't change month by month. Once they go into effect, they will be permanent until or unless Congress changes the law. The same is true for many of the changes that Yingja described, such as the asset limit changes, the dental benefit changes, the monthly premiums. Those are state policy changes, and those are also in state law. And so those won't be changing month by month. Once they go into effect, they will be in effect, and they are as permanent as state law is permanent. So they will remain in effect unless the state legislature changes the law during a future session.
Okay. Sandy Close asks, will a young will a young person who is covered under 19 be able to continue getting Medi-Cal after 19? I assume that means young undocumented person. Will they be
Yes,
considered a Medi-Cal enrollee?
they will continue to receive their current scope of benefits, even though they age out of they are older than 19.
Okay, interesting. And Sandra Martinez Arroyo asks a question that I'll use to piggyback on my question, which is what is a uh, quick soundbite for our media. But her question is, what message could we share with the community to provide them with peace of mind and security given the current situation in Medi-Cal services?
We know this is hard. Change is hard, and there are some changes coming. I think what we try to do is help not panic. We don't want to doom and gloom or catastrophize these changes. At the state, we are approaching some of these changes, you know, as Yinja described, in a way to minimize the impact as much as we can. We want this to be seamless for members so that they keep their coverage. So I think what's helpful to know for members is the actions that they can take are to keep their Medi-Cal contact information up to date with the county and to stay on the lookout for their renewal packet and to stay on the lookout for notices that come to them in the mail. And that's the best way that they can have peace of mind about sort of, the control of the agency that they have to keep covered.
Okay, very helpful. And I would like to ask for a quick 30-second or so soundbite for our media. As Medi-Cal is going through all these changes, what should reporters covering it focus on most?
Think it would be helpful for reporters to help distill all of these complicated changes coming down from the federal government and from the state government into digestible, easy to use information for members, and to help emphasize the steps members can take to keep their coverage, such as keeping their contact information up to date and staying on the lookout for notices and mailings from Medi-Cal.
Wonderful. And Yingjia?
I think Tyler said exactly what I was going to say. So,
Cool. Well, thank you. You were really, really great presenters and did a fantastic job of breaking down a very complex and ever-changing kind of landscape. Um, Please join us tomorrow when we look at what's happening with visas and immigrant women on our Friday briefings. And I want to give a big thank you to DHCS for helping us kick off the first of 6 briefings about Medi-Cal and Cal-AIM and the landscape of what's happening. Thank you.
Thank you all.
thank you, everyone. Bye-bye.